Hey everyone, welcome to Massage Therapy. I'm Moy, your guide to learning massage therapy techniques and body mechanics that make a real difference. Today, we're talking about sciatica. What is it and how to tell if you might be dealing with it with a simple test called the Slump Test that you can do at home or with your patients. But just remember, this is not a diagnosis. If you suspect sciatica, go see your doctor for a full evaluation. That said, let's dive right in. So, first things first, what exactly is sciatica? Sciatica happens when the sciatic nerve, the longest nerve in the body, gets irritated, usually from compression in the low back. This can be from a herniation in the disc, spinal stenosis, or other issues in the lumbar spine. Symptoms usually include sharp pain, numbness, tingling, or weakness that runs from the low back through the buttock and often into the back of the leg. Now, here's where people get confused with piriformis syndrome. The piriformis muscle is deep in the buttock, and when it gets tight or overworked, it can clamp down on the sciatic nerve as it passes underneath. Both conditions can feel very similar: pain down the leg, burning, and tingling. But the origin is different. Sciatica comes from the spine, while piriformis syndrome is more of a muscular entrapment issue. And here's the kicker. Now, daily activities like sitting at a computer for hours, slouching on the couch, or even driving long distances can trigger both. It's not always about lifting something heavy like throwing out your back or something. It can be your daily posture and habits slowly building up tension in those areas. Alrighty, let's walk through how to do the slump test on yourself at home to determine if you may have some sciatica. Sit tall on a firm chair with your legs dangling freely. Place your hands behind your back, then slouch forward, rounding your back. Tuck your chin gently towards your chest. Then extend the leg straight out in front of you, keeping the knee straight. Now, flex your ankle so your toes are pointing towards your face, called dorsiflexion. Hold this position for 5 to 10 seconds. Now, if this produces that familiar nerve pain like tingling, burning, or shooting down the back of the leg, that is a positive sign of sciatica nerve involvement. Just remember, you don't need to crank on it. We're just texting, not torturing. Cool? Now, let's talk about what we can do at home to calm down some of the sciatica tension. None of these are cures, but they can buy you some relief and some comfort while you figure out some of the big picture. Now, let's talk about the first thing you can do, called movement snacks. Avoid sitting for long stretches. If you work at a computer, every 30 to 45 minutes, stand up, walk around, or do a few gentle hip circles. Even 2 minutes can make a huge difference in an 8-hour period. Next, nerve glides, or also known as flossing. Lie on your back. Pull one knee towards your chest. Then slowly extend the leg up and flex. Point the ankle back and forth. Keep it smooth and pain-free. Think of it like flossing the nerve, not yanking on it. Moving on to the gentle piriformis stretch. Cross one ankle over the opposite knee, like a figure 4, and gently pull the supporting leg towards you. This takes tension off the sciatica nerve if the piriformis is clamping down on it. Hold for 30 to 60 seconds. Rinse and repeat. Moving on to some core and glute activation. Weak glutes and core often let the lower back take the brunt of the stress. Things like bridges, bird dogs, or clamshells help rebalance the system or take pressure off the nerve. Okay, let's talk about heat versus ice. If your symptoms feel muscular in the piriformis or the lower back region, use heat. It'll really loosen everything up. If it feels like you have a lot of irritation around the structure of the spine or the base of the back in the sacral region, use an ice pack to really drop some of that inflammation, causing some of your discomfort or sciatica symptoms. Cool beans? And that's a wrap. We covered what is sciatica, the difference between piriformis syndrome, and how to test yourself or a patient with the slump test. If you learned something, please consider subscribing or give that like button. Load to Potman for me. Much love. I love you. Bye. Peace out. Adios. Goodbye. Sayonara.